Well, June is Men's Health Month, a good time to remind the men in our lives to make sure they're healthy. We have Dr. Adam Childs with Arkansas Urology and Chris Shinup with the Arkansas Urology Foundation. Good morning to you both.
Good morning.
Happy to have you both here. We appreciate your time. Let's talk about the foundation first, a bit more of what you all do and how you provide for our community.
Yeah, so Crystal, the Arkansas Urology Foundation really raises funds, heightens awareness for what we do across the state. Arkansas Urology has 13 locations. We serve about 140,000 patients statewide, and we're just really here to support efforts that Dr. Childs and his team do every day.
Absolutely. And Dr. Childs, I want to ask you, as we are entering or about to end June, still doesn't mean that it's time to end those conversations about staying healthy. So what are some ways that men in our lives can stay healthy and maybe some screenings they should be aware of?
Yeah, a lot of ways. Always good for men to be thinking about that, even though it is Men's Health Awareness Month. We should be thinking about it year-round. But there's quite a few screenings that men need to consider, so we certainly advocate for them to get in with their general doctors and get looked over head to toe. There's a long list of general screenings that need to happen, and there's specific urology screenings that, that we advise, especially for prostate cancer. Not every urologic condition can be screened for and caught as early as we want, but there's a lot that can be, and prostate cancer is a big one, being one of the most common cancers that men face. About 1 in 8 men will have to deal with prostate cancer, and the key to getting them the best outcome is early detection.
Absolutely. And at what age would you say it might be a good time to start having those conversations with your doctor?
You bet. It varies a little bit, and it seems like, the guidelines have evolved a lot over the last 10 years, but in general, we recommend men start to generally get screened at about age 50, for some maybe age 55, and for others even as early as age 40, depending on race and ethnicity and family risk factors. Some men who have a family history of prostate cancer in their brothers or in their fathers are at much higher risk and need to be screened at much earlier ages.
And I'm sure I speak for everyone too that sometimes starting that conversation can be a bit uncomfortable. You don't know where to start. So where do we start? Finding a family practitioner? What should we do?
Yeah, I think that's really key. I mean, most men over the age of 30 need to have a general doc to be screened for cardiovascular disease, high blood pressure. A lot of things are going to lead to significant issues even in their 40s and 50s. I wouldn't say there's necessarily an age you have to have a urologist per se, but typically your primary care doctor will send us those men when those issues are arising.
Absolutely. And Chris, how else can we help support the foundation?
Yeah, Chris, I think guys are kind of wusses to what Dr. Childs was saying. We're not the best about going to the doctor. I read something, women are 8 times more likely to go to the doctor than a guy. I think that's just indicative of how early women start going to the doctor and getting annual exams. My granddad always said when I was growing up, it wasn't if, but when he was going to be detected with prostate cancer. So the foundation really exists to provide free first-time screenings for men. We do something in September called Kickoff to Men's Health, and I know Dr. Childs and his team are up here in Fayetteville and Bentonville just to kind of do all they can for the residents of Northwest Arkansas.
Absolutely. Well, we appreciate you both and what you all do for our community, and thank you for joining us this morning.